Hello everybody, this is Dr. Bob DiMaria with another episode of Ask Dr. Bob. Phenomenal questions. Sometimes it amazes me where the information and the questions come from. This person used to smoke, they quit smoking, and they're really having some issues with their breathing and want to know what to do about it. Well, we use a couple products in our practice. One is called Organics, which helps improve oxygenation, and another one is called Pneumozyme, which is lung tissue that helps restore lung function. You may want to contact us. I know that we could make that available to you. What's really interesting also is that we use a pulsometer in our practice to measure saturated oxygen. I may encourage you to seek one of those out, find one, and have your saturated oxygen level measured. What's very interesting about this question, because I believe that you're having some challenges in your genital area that you mentioned in there, and you wanted to know what you could do for that. Anytime a female has any kind of genital issue, I would always suggest that they be checked for a urinary tract infection, a UTI, because a chronic UTI could be very irritating. And I have people in our practice that have issues with that, and they also have parasites. And of course, you might want to be checked for a STD or sexually transmitted disease. And I'm not insinuating anything, I'm just answering your question. This is the first time anybody ever asked me this about Boswellia. Boswellia is an herb that could be used for a variety of challenges. It's literally a natural anti-inflammatory herb that can help improve a variety of conditions in a person's body, would be my best way to answer that. But if somebody has inflammation, like this person had diabetes and gingivitis, I would back off on the sugar, because inflammation oftentimes is caused by sugar. Here's somebody asking about the liver flush that they must have either saw on the website or read in one of my books in regard to when we had the liver flush and what some of what I'll call, quote unquote, the sludge is. You know, the sludge itself, especially the fact that it's green, tells me that it's probably bile, and bile typically comes from the liver. Now, is it a liver stone or is it a gallstone? You know, I'm not going to say that, because I know these globulates tend to break down and dissolve. If you want to go have it done to a lab, you know, more power to you. I've done a lot of different varieties of research on it. I know that that liver is releasing something, because you just normally don't get green globs without there being a demand placed on the liver. Very good question. Somebody had a chronic big toe challenge. Now, in my practice, what we would do is we check your uric acid level to see if you have gout. We have a plan of what we do to help improve and restore uric acid levels, so gout might not be an issue for you. You may consider having some blood work done to determine that. We had an individual who was having some challenges with being pre-diabetic. You mentioned that you watch everything that you eat organic. I want you to know what I have learned for people who are pre-diabetic. You really need to move your body, because exercise helps burn that extra glucose in your body. You may consider cinnamon. Cinnamon has been shown to help improve the whole movement of glucose into cells. You may even consider another item called alpha-lipoic acid. Now, we use some proprietary products in our office when it comes to diabetes and blood sugar stress. Of course, we always do spinal correction, especially to that pancreas area. Exercise is critical. You do not want to deviate from your diet. You do not want sugar in your body. And I know that if you follow these and avoid all grains, all fruit, and I think you'll notice a big difference. This is Dr. Bob DiMaria, and we thank you for joining us today.